fingers. Hi, Katie.
Hi.
I'm Dr. Matt. I'm going to do your exam today. Thanks for coming in. Let's go ahead and verify your chart. I want to make sure that I have all the right information.
Okay.
Can you please verify your date of birth?
March 23rd, 1988.
Okay, do you have any allergies?
No. Just a pollen.
Okay.
Yeah.
Are you taking any medications on a daily basis?
No.
Okay, and you're here for a head to toe exam.
Yes.
When was the last physical that you had?
It was a year and a half ago, yeah.
Okay. Okay, I'm going to ask you a few questions about your medical history. Are you experiencing any joint pain?
No.
Okay. Have you had any surgeries in your lifetime?
Yes, I've had two. I've had a bunionectomy and RCPD surgery, and they both went really well.
Perfect. And when were they?
The bunionectomy was 2013, and the RCPD was this August.
Okay. And no complications, you said? Alright. Any injuries that I should be aware of?
No, I've been having some leg pain lately, and I'm not sure if that's due to an injury while running or not, but just around my knee.
Leg pain. Okay.
Yeah.
And for how long has that been going on?
About a month. Yeah.
Is it in both legs?
No, it's mostly my right leg.
Right leg. And how would you describe the pain?
Is it like a soreness that sometimes gets so intense, especially at night, that it feels like sharp pain?
Okay. Do you feel any tingling sensations?
Not that I've noticed, no.
Okay. Are you experiencing any cramping?
No.
Okay, so you say mostly it feels like soreness. And you also jog?
Yes.
How often?
I run for 40 minutes. I try to every other day, sometimes less during the cold months.
Okay, for how long have you been doing this regimen?
I do it every summer, consistently all summer, and then I slow down in the winter time. So for about 10 years. Yeah.
Okay. So that's a good indication that maybe running isn't what is causing the soreness.
I don't think so, because it's not equal. I mean, it could be, but that's not my instinct.
And have you noticed your reflexes being a little bit slower?
A little bit, yeah.
Okay. Any difficulty blinking or swallowing food?
No.
Okay. Any other pain, muscular, that you would describe in your back or?
My back gets tense from time to time, but I know it's from just anxiety issues. I think there's no sharp pain or injury related. It gets tense.
Okay. Have you noticed any changes with your vision?
No.
And you wear contacts, correct? Okay. What about your hearing? Do you hear any buzzing or sounds that may not be here?
Some tinnitus every once in a while, like a ringing, but it hasn't changed for the last like 15 years, just from time to time.
Okay, so it's chronic.
Yeah.
And that's only in your right ear?
Both ears.
Both. Okay. Was it diagnosed by a physician?
No, I just
realized it.
And I looked it up and just talked to friends, and I think it's tinnitus.
Okay. And did you take any medications that might have caused it?
Not to my knowledge, no.
No injuries to the head?
No.
Okay. Okay, so I'm going to start this exam with vital signs, and I'll listen to your heart and your lungs to make sure that everything is healthy.
Okay.
Okay, I'm just going to put gloves on. Have you noticed any flu-like symptoms in the last 48 hours?
No.
Do you experience any pins and needles anywhere in the body?
No, just like when my foot falls asleep if I've been sitting on it weird, but no, nothing outside of that.
Okay. So I'm going to take your temperature first. This will go under your tongue. I'm going to have you hold it for me. Thank you. And we'll measure your oxygenation as well and your heart rate. Okay, let's go ahead and check this. 98.1, that's perfect. And 96 percentile room air, that's good, and heart rate is 60. Okay. Is it okay if I use this arm? Okay. So I'm going to match the artery. Perfect. We're using the right cuff for this. Okay. This is going to feel a little bit cold. Go ahead and uncross your legs and relax. Blood pressure is 98/60. That's normal. Okay. So I'm going to start with a gentle scalp and face palpation. Alright, so go ahead and relax. I'm going to apply pressure on both sides of the head at the same time. Go ahead and tell me if you feel pain.
No.
Okay.
No.
Okay, I'm going to check your scalp. Scalp is very clean. Looks like there's no redness and even distribution of the hair follicles. I'm not noticing any signs of alopecia. No signs of dehydration. The hair looks very healthy and even distribution. Okay, so let's go ahead and check your vision. I'm going to ask you to look straight at my nose. I'm going to flash a light in your eyes. We're going to check pupil dilation and constriction. Very good. Okay, go ahead and follow the light with your eyes only. Don't move your head. Okay, now go ahead and look right here for me. Now look here. Okay. I'm going to check inside your mouth. So I'm going to look at the tonsils. Not noticing any redness. Go ahead and say ah. Alright, are you experiencing any throat pain?
No.
Okay, let's go ahead and check your sinuses. So I'm going to palpate right here in between your eyebrows.
Okay.
And right under your eyes. I'm not feeling any swelling. Okay. Go ahead and smile for me. And frown with your eyebrows. Good. Puff your cheeks. Keep them puffed for me. Don't let me unpuff them. So try again. Don't let me unpuff them. Okay, good. Very good. Go ahead and relax. I'm going to put my hands on your shoulders. Go ahead and shrug them. Okay. And now I'm going to try to push your head to the right. Don't let me do that. Okay. Alright, I'm going to palpate your mastoid bone now. Looking for any signs of mastoiditis. And any pain when I pull up on the...
No.
Okay, go ahead and close your eyes. Go ahead and tell me with which ear you hear the sound.
Left. both.
Okay. Going to take a look inside your ears. Right. Tympanic membrane is per gray. I'm not seeing any redness or pus. The canal is relatively clean. And very good. It looks like you're not inserting the Q-tip inside. That's good.
Yeah.
Okay. Right here has clean tract. Tympanic membrane is well marginalized. No fluid buildup behind it. No redness. No signs of infection. And the hearing seems to be normal. Let's go ahead and check with a tuning fork.
Okay.
Go ahead and tell me when you don't hear this sound anymore.
No. No.
Now tell me which position here is louder, position 1 or 2. 1, 2.
2.
1 or 2.
2.
Okay, that's good. Alright, so I'm gonna have you change into this gown, and when I come back, I'll do a full body exam as well.
Okay. Thank you.
I'm going to palpate your lymph nodes. We're looking for anything that is swollen. So we have here submental lymph nodes, followed by cervical and preauricular. And postauricular lymph nodes, which are a little bit down the neck, behind the ear. Moving down the neckline. Right above the clavicles. Okay. And cervical occipital lymph nodes, which are a little bit behind the neckline. Okay. I'm going to listen to your heart. Is it okay if I open the gown?
Yes.
So I'm gonna have you breathe normal. can hear only S1 and S2, no S3, no S4. We're going to check for murmurs with the bell. For this, I'm going to ask you to take a deep breath and hold it for 3 seconds. 1, 2, 3. Breathe out. Very good. And now go ahead and breathe in and exhale. Good. Breathe in and exhale. Okay. I'm going to listen to the jugular as well. So we're looking for aortic stenosis or bruit. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Now I'm going to compare with the other side. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Okay. Going to check your facial reflexes. So go ahead and relax. You're just going to feel a gentle tap. Relax your jaw. So we're just tapping on the bony prominences. Okay, I'm going to check your scalp sensitivity. Okay, now we're taking a better look at the scalp. We're looking for swelling and any fluid that is building up. I'm going to do a few tests here. Go ahead and tell me if this feels cold or warm for you.
Cold. Warm. Cold. Warm. 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 Cold.
Okay, now I'm going to touch you with two textures. One is going to feel sharp and the other one is going to be dull. This is what sharp is going to feel like. And this is what this going to feel like? Go ahead and confirm if you felt those.
I could barely feel the dull one.
Okay. So let's go ahead and try and see how this does. Go ahead and tell me if you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp.
Okay.
Sharp. Dull. Dull.
Okay. Very good. I'm going to start with the lower body now and examine your abdomen as well. Is it okay if I open the gown? Okay, so I'm going to take a look at your abdomen. We're looking for any redness. Okay, first I'm going to visualize. I'm noticing a little bit of swelling that just want to make sure it's not related to any organ. I'm not noticing any redness. So first I will listen for any normal sounds. It's gonna feel a little bit cold. Normal activity is heard on all four quadrants. I'm listening to the aorta for any bruit. Going to palpate, starting with liver. We want to make sure that margins are right under the rib cage. Also, I'm not noticing any swelling. Okay, let's go ahead and take a few measurements. We're looking for inflammation that would be triggered by asymmetry. Okay. Go ahead and tell me if you feel this on the left or right.
Left. Right. Right. Left. Left. Right. Both.
Go ahead and tell me if you feel this 2 or 1 pressure point.
2, 2, 1, 1, 2, 1, 1, 2, 1, 1, 1, 2, 1, 2.
Okay. Go ahead and take a look at your back. I'm going to take a look at your skin on the back. I'm noticing that you do have more than maybe 50 moles, so you need to take extra precaution with sun exposure and to minimize toxins. Looking at the back and musculature to see if there is anything swollen. Take a few measurements. We're checking for asymmetry and inflammation around the spine. You did notice that you were having a little bit of tense muscles due to anxiety. I just want to make sure that physiologically everything is normal, that there's no fluid buildup. Okay, first I'm going to listen to your lungs. Go ahead and take a deep breath in and exhale. We're looking for any abnormal sounds. Again, breathe in and breathe out. Breathe in, breathe out. And again, breathe in and breathe out. And again, breathe in, exhale. Breathe in, exhale. Breathe in, exhale. Okay, up again. Then go ahead and breathe normal. You can breathe normal. Going to do a skin perfusion test. A little bit more flexibility on the right side. I'm going to test your dermatomes. Go ahead and tell me if you feel this cold or warm.
Cold. Warm. Warm. Cold. 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 Warm. 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 Cold.
And I'm going to touch you with two textures. One is going to be sharp and the other one is going to be dull.
Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. sharp, sharp, dull, dull, sharp, sharp, sharp.
Okay. Looks very good. I'm going to check your legs now and your feet. Okay, Katie. I'm noticing a little bit of bruising around the second toe. And I know you mentioned that you jog a lot, so maybe we can recommend switching shoes and finding a better support for your feet.
Yeah.
Okay. Let me know if you feel any kind of pain. So I'm expecting that you'll feel a lot of soreness like you described.
Yeah, a little bit there.
Okay. We might experience a little bit of maybe a fissure of one of those bones that connect together. And the only way to tell if that's the case is to do an x-ray and check for any bone fracture. Just going to take a look in between the toes to see if there is any cracking of the skin. You mentioned your right leg was the one that was causing you a little bit of extra soreness. Go ahead and wiggle your toes for me. Okay, that's symmetric. And close your eyes. Tell me on which foot you feel this. Okay, and this. And this. And this. Good. Going to check your reflexes. Good. You did mention that your reflexes were also diminished, so I would say bilateral too. Going to check your pulses. 2+ is strong. Okay. Capillary refill is within 2 seconds. It's very normal. Go ahead and tell me towards which way I'm moving your toe, towards you or towards me.
Towards me. Towards you.
Okay.
Towards you. Towards me.
Okay, very good. I'm going to check your Babinski reflex. Okay. Okay. Perfect. Go ahead and wrap your toes around my fingers. Very good. I'm going to try to push the feet towards me. Don't let me do that. Okay. I'm going to try to push them now towards you. Don't let me do that. Very good. I'm going to try to open them. Don't let me do that. And close. Okay. Very good. So go ahead and turn on your belly. I'm going to take a look at your calves and see if there's anything that we can do there.
Okay.
Okay, so just pressing right behind the knee capsule to see if there is any swelling. Going to check for asymmetry. Okay, I'm going to try to push down on your right leg, and in the same time, go ahead and try to lift it up, okay? Go ahead and try and lift it up. And resist. Good. We'll do the same thing on the other side. And resist. Good. Okay, so bilateral strength, I would say 3. We're going to go ahead and do a lymphatic massage. This is an anti-inflammatory oil that helps with lowering fluid buildup. It increases circulation in the area, so the soreness is definitely going to decrease. We're just slowing, moving up the lymph so that we can equilibrate the system. This is going to feel a little bit cold. I'm applying cryotherapy to the muscles, cells to lower inflammation in the body. Using a little bit of manual therapy to increase circulation. I'm going to go ahead and just take a look at your chart. So we did a very detailed full body exam. I did notice a little bit of swelling in the back, so I do want to do more testing to make sure that it's just muscular. And then we did do a lymphatic massage that will help with the soreness you're experiencing in the legs. Okay, and I would like to see you back again in about 2 weeks. We can definitely do another lymphatic massage and see how the soreness feels. I don't want you to take it slower unless it really bothers you, the pain. Because I want your body to get used to running and being active. But we definitely don't want you to be in any pain so that, it's not any discomfort. So if you need to come in sooner, just go ahead and give us a call.
I will, and it felt really, really good. So thank you for the treatment in addition to the exam.
You're welcome.
All right.
Very nice to see you. Hi, Angelina. Hello. Thanks for coming in.
Thanks for having me.
Absolutely. So you're having some more back pain. Go ahead and tell me, how long has this been going on?
So this has been going on for the past few weeks. I've kind of been feeling some pain up in my upper shoulders, and then also like within my lower back as well.
Okay. Have you noticed any rashes or itching?
No.
Okay. Have you been traveling outside the country lately? Any injuries to the back, to the shoulders, the head?
Not recently, but I had injuries a few years ago.
Okay, and tell me more about it.
I was in gymnastics and I had landed on my neck, and ever since that injury, I've had some back pain.
Okay. And are you noticing any indigestion or any cramping, especially before your period?
Yeah, I have noticed some cramping, but everything else has been normal.
Okay. And is that something new or something that has been going on after the accident?
I wouldn't say it's new.
Okay. And do you remember if you were having the same symptoms before the accident?
Yeah.
Okay. So that must be something that is related to your normal cycle. Any numbness around the back or down the fingers?
No, it's never down the fingers or anything like that.
Okay. Have you noticed any increase in headaches?
Yeah, I've noticed an increase in headaches, and then also the back of my neck does tend to get sore at times.
Okay. All right. We can definitely take a look and see how the alignment looks. And one last question. Are you having any pain down your back going to the sole of your foot?
No.
Okay. So we're going to check for sciatica too, just to rule out and make sure that there's nothing imbalance in the hips. And we're going to look at the cervical spine and see how that feels. Okay. So go ahead and stand up for me. Okay, so go ahead and take a few steps towards me. Okay, turn around. Keep walking. Just looking at the gate and how you place your feet. Go ahead and come back on the mat. All right, keep walking towards me. I'm going to have you turn around. Let's take a look at your back now. Okay, I'm going to feel my fingers just pressing down on the spine. This is where the pain is located, right?
Yeah.
Okay, as I'm pressing down, I'm going to have you try to touch with your left ear, your left shoulder. Okay, come back to center. And let's do that again on the right side. Okay, come back to center. Now go ahead and try to touch your chest with your chin. Okay, curve and curb your shoulders inside As you're doing that, try to touch your chest. Okay. Come back to center. Okay, just going to palpate trapezius muscle. And not feeling any increased tension here on the left side. Let's check right. Okay. Go ahead and lift your arm up. So we're going to do a 90-degree angle. Just going to slowly palpate around the shoulder area. And come back to center. Okay. Now go ahead and move your arm away from your body. So basically we're testing different grip muscles to see exactly where the pain originates. Come back to center. So let's check the other side. Perfect. Any pain here?
No.
Okay, it does feel like there's a lot of tension, feeling a knot in the back of the acromion. Okay, now go ahead and come back to center, and we're gonna do the same thing. Okay, any pain here?
No, it's just a little tight.
Tight. Okay, we don't want that. Okay, come back to center. So, just going to slowly palpate around the spine. I'm just gonna move this. I cannot move it. It's okay. No, I'll just leave it. Okay. Just going to slowly palpate around the spine. Okay. Go ahead and relax your hand. I'm going to have you try to touch right here where I'm touching you right now. Okay. So I'm going to press down on your palm as you're trying to do that. Go ahead and tell me if you feel any pain anywhere.
Just near my shoulder blade.
Okay. Is it coming from here?
Just about there.
Okay. Just like I suspected. So there's an impinged nerve that we can definitely try to loosen up. Let's go ahead and check on the other side. So just let me find the spot. Okay, go ahead and try to touch right here. Perfect. Okay, a lot better mobility on this side. I'm going to do the same thing. So I'm going to tap. Any pain?
No.
Okay, just going to slowly press down. Any pain? Okay. Okay, checking your lumbar and sacral region.
It's a little sore there.
Okay, and is it moving down?
No.
It stays there. Okay. Okay, quite a movement here, so that's good. Okay, I'm gonna have you lay down and we're gonna start with a hip adjustment. Okay, so go ahead and put your arms around you like you're giving yourself a hug. I'm gonna have you scooch on your right hip. So turn your whole body. There you go. Now bend this knee up. There you go. And on the count of 3, I'm gonna have you take a deep breath in. 1, 2, 3. And breathe out. Good. So we'll do the same thing on the other side. I'm going to have you scooch on your left hip. 1, 2, 3. Breathe in. Breathe out. Okay. Perfect. So let's go ahead and check the length of your legs. Okay, so your right leg is actually shorter than the left one. And let's see how much movement is in this right leg. Okay. Okay. Just going to stretch these legs out a little bit. So we're going to make you a tiny bit taller. Take a deep breath in. Breathe out. Good. And again, breathe in and breathe out. Okay. Go ahead and relax your feet. Okay. That's very good. Lots of movement in here. Okay. Let's go ahead and check your arms. Okay. Any pain as I'm pressing down here?
It's just a little sore.
Okay. Go ahead and take a deep breath in. Breathe out. Good. Okay, just slowly going to press down from the shoulder joint. Go ahead and take a deep breath in. Breathe out. Very good. Okay, let's take a look at your neck. Okay, I'm just going to palpate your neck. And before we do a neck alignment, I want to see if there are any adhesions that we need to loosen up. Okay. It does feel very tight, and I would like to work on these muscles before we do any adjustments. Is it okay if I lower the straps?
Yeah.
Okay. So we're just gonna go ahead and push these to the side, and I'm going to apply an anti-inflammatory oil. It has eucalyptus infusion. So I'm just going to apply it all over the trapezius muscle, going into the occipital muscle. I'm using the main pressure points to activate lymphatic drainage. Just trying to stretch these muscles and loosen up the adhesions that have been forming. This adjustment is going to help to increase mobility in the cervical area. I'm going to apply cold therapy. Go ahead and relax your neck. This helps to reduce inflammation. Okay, so let's go ahead and see how this feels now. Okay, a lot better. Well, I definitely feel more blood pumping through. It feels more mobile, softer. Okay. Go ahead and take a deep breath in and breathe out. And again, breathe in and breathe out. Okay, perfect. I'm going to do a cranial adjustment as well. Try to find the meridians that help with muscle tension. going to have you move on your belly. I have here a nervous scope. It's going to help to register heat differences in the tissues along the spine. Okay, so we are currently at T1, T2. Just gonna move this a little bit to the side. Slight heat difference, I would say about 2-3 degrees at L1. Okay. So we're going to check lumbar and cervical connection. Just going to slowly palpate. Okay, the plexus looks a little bit inflamed on the right side. I'm going to see how the connection looks with cervical plexus. Okay. Go ahead and lift your left leg up. Good. Come back to center. Right leg. Come back to center. Left leg. Hold. Come back to center. Right leg. Up. Hold. Come back to center. Okay. Go ahead and take a deep breath in. Breathe out. Okay, go ahead and lift your legs up in a 90-degree angle, both of them. Very good. Take a deep breath in and hold it for 3 seconds, okay? And relax. Okay, we're going to do skin pulling. Okay. Gonna do some shoulder adjustment. Breathe in, breathe out. I'm going to apply an anti-inflammatory oil. just working on the sacral and lumbar region to soften the tissue. Creating some spaces in between the lumbar vertebrae. It's going to help with the lower back pain that you're having, especially after the accident. So it's going to increase circulation in this area, helping with any digestive problems. There's a lot of parasympathetic innervation that we're triggering right now, and that's going to help with all the main organs found in this area. Going to slowly work on the lymphatic drainage from the hip region, moving the lymph down, just helping it to drain so that we are moving the fluid. This is a very gentle cupping. It helps to increase circulation. Sorry. Okay, I'm going to use acupressure to activate the plexus. Any pain as I'm doing this? Okay. Okay, activating the craniosacral region. Any pain in the shoulder still? Just gonna move your hair. And I'm going to palpate to massage the occipital area. I'm going to do a little bit of hair pulling. It helps to decrease tension in this area. TFEH.
Dull, sharp, warm, sharp, warm,
Hi, Alina.
Hi.
My name is Dr. Matt. I'm going to do your exam today. Can you please verify your last name and your date of birth?
Sure. Brown. May 15, 1968.
Perfect. Do you have any allergies?
No.
Okay. And I see here in your file that you've been having some sensitivity on the right side of your face.
Yes.
Okay. How long ago did this start?
A couple months ago.
Any pain associated with that?
Sometimes in the morning when I wake up and brushing my teeth.
Okay. And tell me a little bit about your neck and back pain. How long has that been going on?
Already like a couple years. Like sometimes it's too bad. Sometimes when I'm exercising and doing massage, it's better. But like around 2 years.
Okay. And have you noticed any numbness in your toes or fingers?
Not really.
Do you wear contacts or wear glasses?
Contact lens.
Contacts. Have you noticed any blurry vision, fogginess on one side, any dark spots anywhere in your vision field?
I'm definitely seeing better with my right, but left one.
Okay.
But no, not foggy, nothing like that.
Okay. Have you had any surgeries around your face, neck, or
No.
shoulders?
No surgeries at all.
Okay. And are you taking any medicine on a daily basis?
No.
Okay. At any point in the last year, have you noticed any weakness on your arms or legs?
I can notice when I'm exercising, at the end of, practice, kind of feel weaker than before. Can tell. Especially legs.
Okay. Is that on both sides kind of equal or one side more than the other?
I think equally.
Equally. Any headaches that don't go away with medicine or that they are too frequent?
Once a month. I don't know if it's normal, but when I have a period, before like 2-3 days when it started, and after, like it's the whole week, like migraine, I can tell.
Okay.
It wasn't like this, like the whole my life. Before it was like more like belly pain. Right now it's a headache. I don't know if it's considering as a migraine.
So we can definitely try and check and see if it is hormonal related or neurologically.
Okay.
Okay. And when was your last checkup?
With a physical checkup, I believe 2 years, for sure.
Okay. Is there anything in particular today that you would like me to address that I didn't specify?
Mostly I'm concerning my neck. Like it's always like not enough, I don't know how I can remember it, how it was, before, more free and easy to turn, especially when I'm driving a lot.
Okay.
It's like terrible after a couple hours.
Okay.
Not manageable, so maybe I have to fix it somehow.
We can definitely check and see if it is muscular, neurological, or if there is anything else that we can investigate, and we'll let you know.
Sure, thank you.
Okay, perfect. So I'm going to start with vital signs. I'm going to take your temperature, your blood pressure, and listen to your heart and lungs. Did you have anything to drink before coming in?
Oh, just water.
Okay. So this is going to go under the tongue.
Oh, nice.
I'm going to put this under the tongue and I'll have you hold it for me. Perfect. And then this will monitor your oxygen. So it's going to go on your index finger. Go ahead and relax. Okay. Let me go ahead and check. 36.3 Celsius. That's perfectly normal. And then oxygenation is 97% on room air. Heart rate 75.
Is it okay?
Yes, it's very normal. Okay. I'm going to listen to your heart and lungs. Okay. I'm going to have you breathe normal first and relax. I can hear only S1 and S2. No S3, no S4. Going to listen with the bell. So we're looking for any murmurs. I'm going to have you take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Go ahead and take a deep breath in and exhale. And again, breathe in and exhale. So I'm going to take your blood pressure. Is it okay if we lift this up a tiny bit? Okay.
I like the color.
Thank you. Okay. Okay. (110/70). That's also normal. So far, everything
A
looks
little
good.
bit lower than.
No, it's perfect. Okay. So I'm just going to do a quick eye checkup. I'm going to have you cover your right eye. And with your other hand, go ahead and hold the Snellen chart. Extend your arm all the way. That's perfect. And can you please read this last row starting with the first letter towards me?
LTFBH.
Okay. Go ahead and tell me what color you see here.
Green.
And here?
Red.
What number do you see here?
2.
And here?
6.
Which circle is larger, 2 or 3?
Larger is 3.
Okay, go ahead and switch eyes.
Same thing.
Go ahead and read the last row, starting with the first letter to the right.
H, P, F, T, L.
Okay, and do you see the same intensity of red?
Yes.
Okay, and the same green. What number do you see here?
4.
And here?
9.
Which circle is smaller, 3 or 4?
3.
Okay, very good. Okay, perfect, Alina. So I'm gonna go ahead and let you get dressed in our clinic gown, and then we're gonna do a neck and head inspection and see exactly what's going on.
Thank you.
Great, put gloves on, and I'll start by palpating your face. Okay, let me know if you feel any kind of pain.
No.
Palpating sinuses in between your eyebrows, feeling for any tenderness or swelling. Gently palpating all around the orbital area, looking for any fluid or tension. Noticing a little bit of asymmetry on the nasal septum. No swelling around the masseter muscle. Palpating preauricular lymph nodes. Moving to postauricular lymph nodes. Turn a little bit behind the ear and to lower on the neckline. This is where we can find the cervical plexus as well. Moving up to the submental lymph nodes. I'm not noticing any swelling. Going to turn your head towards the left. A little bit of tension behind the neck region.
You can feel it.
So I'm going to do a little testing here. So I'm going to touch it with two textures. One is going to feel dull. This is what dull is going to feel like. And the other one is going to feel sharp. This is what sharp is going to feel like. Go ahead and tell me if you feel this sharp or dull.
It's just dull. Dull. Sharp. Dull. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Dull. Dull.
Does this feel dull or sharp?
No. No. No.
Noticing a little bit of redness on the back of the neck. It does look like it's a sunburn.
Mm-hmm.
Have you noticed any sensitivity on the scalp?
No, not really.
Okay, I'm going to do another sensory test. Go ahead and tell me if you feel this cold or warm.
Cold. Cold. Warm. Cold. Warm. Warm.
Go ahead and tell me if you feel this vibration or pressure.
Mm-hmm. I think it's vibration. Pressure. Vibration. Pressure.
Go ahead and tell me if you feel this 1, 2, or 3 taps.
3. 2. 3. 2.
Okay, I'm gonna turn your head towards the right. First, I want to palpate and make sure that there is no inflammation. palpating the occipital lobes and the masseter bone. We're looking for signs of mastoiditis to see if there is any infection, something that we could identify as a trigger. I'm not noticing any redness, fluid buildup. No signs of edema. I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one's going to be dull. This is what dull is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Sharp. Dull. Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. Dull. Dull. Sharp. Dull.
Now I'm going to touch you with 2 or 1 pressure points. Go ahead and tell me if you feel this 2 or 1.
One. One. 2, 2, 2, 1, 1, 1, 2.
There's definitely a little bit less redness on the left side. Go ahead and tell me if you feel this 2 or 1 pressure points.
1, 1, 2, 2, 2.
And do you feel this cold or warm?
Warm. Warm. Cold. Warm. 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 Cold. Cold.
And then I'm going to touch you with a sharp or a dull object. This is what sharp is going to feel like. And this is what dull is going to feel like. Go ahead and tell me if you feel this sharp or dull.
Dull. Dull. Dull. Sharp. Sharp.
Do you feel this sharp all the way down?
Yes.
Do you feel this dull all the way down?
Yes.
What about now?
At the end, more sharp.
Okay, I'm going to go ahead and do an abdominal assessment. I'm going to listen to your abdomen first with a stethoscope. This is going to feel a little bit cold. I'm going to start with the right upper quadrant. Moving down to the right lower quadrant. Left upper quadrant. Looking for abdominal distension, absent sounds that could trigger some abnormalities. Going to do a gentle palpation. Let me know if you feel any pain. Dividing the abdomen into 4 equal quadrants. I'm not feeling any lumps.
It's not pain, but slight discomfort in the middle.
Okay. I'm going to go ahead and come back to the pelvis area. Just feeling the abdominal aorta. 3+ pulsations. Diminishing as we're getting closer to the trunk. I'm going to do a sensory test. Focusing on the right upper quadrant first. Let me know if you feel this sharp or dull.
Dull. Dull. Sharp. Dull. Dull. Sharp. 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 Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
I'm going to look for any abnormal pulsations. Just going to take a look at your nail beds. Good capillary refill. No splinter hemorrhage. So we're going to take a look at your back now. I'm going to listen to your back, starting with the neck area. We're looking for any abnormal sounds, burrowy, crackles, the wrong eye, microscopic sounds that could be a symptom of what you're dealing with. So we're first listening to the paraspinal area. Listening along the scapula. Gentle palpation to check for any vertebrae dislocation. slight deviation of the spine towards the right, so gotta keep an eye on it. We to do a test here. Go ahead and tell me if you feel this on the left or right.
Right. Left. 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 Right. Right. Left.
Okay. Go ahead and tell me if you feel this 2 or 1 pressure point.
1. 2. 2. 2. 2. 1. 1. 1. 2. 1. 1. 2. 1. 1.
I'm going to touch you with 2 textures. One is going to feel wet and the other one is going to feel dry. Tell me if you feel this wet or dry.
Dry. Dry. Left. Right. Dry. Dry. Wet. 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 Dry. Dry.
Next, I'm going to draw a few shapes. I'm going to need you to tell me what shape I'm drawing, okay?
Circle. Square. Triangle.
Okay, now go ahead and tell me what number I'm drawing.
Okay. 11. 8.
6, maybe 9.
Okay. Go ahead and tell me if you feel this pressure or vibration.
Vibration.
Tell me when it stops.
Stop.
Same thing. This
Vibration.
vibration. Tell me when it stops.
Stop. Vibration. Stops. Pressure. Pressure. Pressure.
Okay, to take a few measurements. We're checking for misalignment and asymmetry. Slight inflammation on the right midsection. Just going to check for any abnormal pulsations. No abnormal sounds. No bruit. We're looking at a muscular and nerve impingement that could be causing the pain. Okay, Alina. Everything looks relatively good. We're just going to run a few more tests besides the exam that we did. So we're going to do a CT scan and an x-ray of the spine. I want to see if there is like a nerve impingement or something that is obstructing the nerve that is going through the spine, okay? Okay. Otherwise, everything looks good. Heart, lungs, vision, and I did notice that you're having some sensory perception, and we're going to go ahead and figure it out with these tests. Okay. In the meanwhile, you can take some Tylenol if you're having some extreme pain, and let us know if there's anything that we can prescribe. And if you're having any weakness in your arms, also let us know. Okay. Thank you, Alina, for coming in. Do you have any questions?
No. I'm good. Thank you.
You're welcome. Okay. I will see you soon, and I'll let you know when we have the results.
Thank you.
You're welcome. My name is Dr. Matt. I'm going to do your exam today. Can you please verify your first and last name and your date of birth?
It's Amanda Jackson, and the date of birth is 7/22/2000.
Okay, perfect. And do you have any allergies?
I'm allergic to gluten.
Gluten. Okay. You're here for a scalp examination, correct? Okay. Are you experiencing any itchiness?
A little bit, especially with the weather changing. It's been getting pretty bad.
And where have you noticed it more frequent?
Mostly like on the very top.
On the top. Do you experience any dandruff?
A little bit, yeah.
Okay. What kind of shampoo do you use?
I just use Amica.
Is that what you've been using for the last 3 months?
Yes.
Okay. Do you use the same conditioner?
Yes.
Okay. Do you use any serums?
No.
Okay. Are you taking vitamins?
I take melatonin at night, but no other vitamins or anything.
Okay. Okay, so you're taking melatonin at night, no multivitamin. Any medications on a daily basis?
No medications on a daily basis. I take ibuprofen sometimes, but other than that, nothing.
Okay. Occasionally. Are you experiencing frequent migraines?
I wouldn't say frequent, maybe like once or twice a month.
Do you think they're in relation to your monthly cycle?
Maybe.
Okay.
Sometimes they're a little all over the place though.
Okay. And do you experience any kind of pain or numbness around the scalp?
Sometimes pain, but no numbness.
Okay.
And nothing too crazy, just a little bit.
On a scale of 0 to 10, how would you rate that?
Like a 3.
Okay. And how would you describe your diet?
I tend to eat pretty healthy. I'm a vegetarian, so I eat a lot of fruits and vegetables too.
Okay. Perfect. And how often do you change your pillowcase?
I would say I wash it about once every week or two.
Okay. And how often do you change the actual pillow?
Once every couple months.
Okay. We can go ahead and start the examination. I usually start this process with a pH testing. We want to make sure that your scalp is not too acidic. That definitely encourages the increase of bacteria or viruses on the scalp area. Okay, I'm just going to write here. I'm going to take 3 samples. This is 1. We're going to apply solution that helps to determine the pH. First, we're testing the top part, and then we're going to take a sample from each side, right and left. Okay, so this is sample 1. Second, we're going to use the same basic solution to help determine this one is going to be on the side. I'm just going to have you turn your head towards the left. Then we have here the third sample. Okay, go ahead and turn your head towards me now. Okay, now that we have the third sample, we're just going to go ahead and run this to the lab and we'll determine what kind of treatment we need to do, okay? Okay, I'm now going to put gloves on and I'll dive right into the scalp exam. Now that we have your pH results, we kind of know the route we need to take. Go ahead and lift your head up. Okay. The first step is to take a look at the skin. We're going to use a magnifying glass that helps us visualize the hair follicle and see if there's any skin disorders that we need to treat. Go ahead and turn your head towards the right. I'm just going to brush this part. Good. And left. Going to take sections and we're going to visualize the skin. Gently, I'm going to be pressing down so that we can visualize the skin better. Okay, a little bit of flakiness around the root of the hair follicle. Overall, I would say that it looks pretty clean. I do notice some buildup. I can tell that you're experiencing a little bit of hair thinning. Definitely noticing more buildup around the hair follicle as we're moving up, and some product buildup. Okay, we're looking at the health of the hair follicle, I'm not seeing any infection. Dryness. Dry patches. And some redness. A lot of build-up here as we're moving towards the part that you said you're experiencing more symptoms like itchiness, which can definitely explain. Okay, let's take a look right behind your neckline. Okay. Okay, base of the scalp looks a little bit worse than the front. Probably this is the part that you're not able to shampoo that well. And it's very normal. Sometimes even an imbalance in hormones can trigger dryness. It's definitely a combination of dry and oily overall on the scalp. Okay, I'm gonna move towards the top. Okay. A lot of redness. It could be a lack of oxygenation towards the scalp area. Not necessarily the brain, of course, just the skin. Okay, go ahead and turn your head towards the right. We're going to take a look on the left side. Okay. Overall, I would say there's a lack of circulation in certain areas, and that can trigger for the scalp to have less oxygen. Okay. Hair follicle has even more buildup on the left lower side, so that's right behind your ear and behind the neck area. Okay. Not so much thinning of the hair, but just increased oiliness, which is normal, especially if you are on day 2 or 3 of washing. Okay, that's a lot of sebum there. Sometimes too much production of the gland oil can be detrimental. Okay. I'm going to take a picture of this. Perfect. Okay, I'm going to start with the front part. I'm going to do a hairline test. I'm going to look to see if there is any inflammation. It's going to feel like a mild tapping. Go ahead and turn your head towards the right. Go ahead and tell me if you feel this cold or warm.
Cold.
What about now?
More. More. Cold. Cold. Cold.
Okay. And does this feel sharp or dull?
Dull.
Go on and tell me if this feels sharp or dull.
Sharp. Sharp. Sharp.
I'm going to do a vibration test. Go ahead and tell me when you don't feel the vibration anymore.
It stopped. It stopped.
Okay. Does this feel cold or warm?
Cold.
What about now?
Cold.
Does this feel cold or warm?
Cold.
How many taps do you feel this tap? 1, 2, or 3?
2. 1. 2. 3.
And does this feel sharp or dull?
Sharp. Sharp.
Okay, go on and check the other side. How many times do you feel a stab? 1, 2, or 3?
2. 1. 2.
And does this feel cold or warm?
Cold. Cold. Cold.
And did that feel the same on all 3 parts?
Yes.
Does this feel cold or warm?
Warm.
Warm on now?
Warm.
And now.
Warm.
Okay, I'm going to touch you with a sharp or a dull object. Tell me if this feels sharp or dull.
Dull. Sharp. Sharp. Dull. Dull. Dull.
And does this feel cold or warm?
Cold. Cold. Warm.
We're going to dive into treatment, starting with an acupressure method that helps to activate certain points on the scalp. So this is going to feel kind of like a pushing sensation. If there's any part that feels more sensitive, let me know. This will help to activate the main sensors of the scalp, and it's going to make the massage more beneficial. I'm going to apply a hair serum. It has ashwagandha exosomes. It will not leave the hair oily. It's going to feel a little bit cold. We did leave it at room temperature to avoid that temperature shock. Just applying a few drops that we're going to massage everywhere. It's going to help with the thinning of the hair that we noticed on this side, and also with the buildup. Going to apply this at the base of the scalp. And it helps to increase circulation towards the baby hairs that surround the scalp area. Okay, we're going to go ahead and turn on the other side. Okay, we're going to start with the same ashwagandha serum. Applying it at the roots. This is going to help with circulation. you. I'm going to apply a little bit of heating. This is going to get warm. It'll help with circulation. Okay, let me know if it's too hot. We're using a meridian brush. It has light energy, thermal energy, and bioelectricity. How does this feel?
Feels good.
We're using microcurrents to help with circulation. Go on and turn your head up. That's good. Okay, Amanda. We were able to do a treatment today that will help with follicle regeneration. You're gonna see a little bit decreased serum production, and your hair is not going to get oily that fast. I think overall the hair and the scalp look pretty healthy. Maybe just try to minimize the product that you're using. Sometimes that can be detrimental to the scalp health.